And when you were made, and you got a set of genes that enabled the diabetes process to occur. Now, you know nobody can control what genes they get. Right? And nobody can control, your parents couldn't control what genes they gave you. This is as random an act, and we don't know, most of us, you can't find out right now what all your genes are if you want. But most of us don't know what our genes are or what we give to our children, or even what our futures hold. So the genes are there, and these are common genes, particularly in European descent people. So for those of you who aren't sure where your descent perhaps comes from, all your ancestors, we know that these genes are the most common where? In Europe. In what country in Europe?
Scandinavia.
Finland.
Damn.
So somehow our Finnish friends were maybe all related somehow way back there.
Freaking Vikings.
So,
The Vikings.
and what those genes enable to have happen is that your immune system destroys the cells in your pancreas that make insulin. It sounds like maybe it's a simple process, but it is such a complicated process, we can't figure out how to unlock it and fix it. And I'll show you a little bit about some of the things we've tried and we're still trying. And then, can it be prevented?
Nope.
No. Not yet. We're working on it. I'll show you some of the things we've tried to prevent it with. So far, nothing has worked. And then, what's the treatment? Insulin. No other, I love people saying, well, now you're older, can't you take pills? And you know the answer to that.
Only on Saturday.
What are we worried about? I mean, if diabetes didn't have the complications associated with it, probably none of us would have to be here. Because it wouldn't be about managing it, about having a workplace or a school where you can manage your diabetes effectively, or having a government that gives you access to the medicines that you need. So it's really about managing this disease. And when you do manage it, what's the complication rate? Almost zero. When you do manage it, what happens to your lifespan? Nothing. You live as long as anybody else who doesn't have diabetes. And what happens if you don't manage it? You can end up with complications. So it's really about management. And when you read and people talk about, Aunt Tilly's friend ran into all this trouble from her type 1 diabetes, who cares about Aunt Tilly's friend? You've got to care about yourself and your friends, and help. You got to stay focused on managing your diabetes, and if you can, help everybody else as well. So what are some of the things that really we are concerned about with diabetes? What's one of the biggest complications? Diabetic ketoacidosis. Who was in diabetic ketoacidosis, the diagnosis? Do you know? And if you've ever been in it again since you were diagnosed, this is a really serious complication. Do you know what it's due to?
No insulin in your body.
Not enough insulin. So you're not taking enough insulin, or when you first were diagnosed, you didn't have enough insulin left in your body. And how do you end up with not enough insulin? You forget a couple shots. You ran out of medication. Perhaps you're in a country in which it may not be so easy to get enough insulin. But the most important thing is when you get sick, let's say you get the flu or something happens or you're really stressed, what do you need? You need the same amount of insulin when you get sick? Or you get stressed? No, you need more. And if you don't take more, you can end up with diabetic ketoacidosis even if you've taken your shots for the last couple of days. So the point is to take not just any insulin dose, but to take the right amount of insulin for what's happening with your body at that point.